Hi everyone, this is Dr. Heather Austin Robillard, and this lecture video is going to be over the stages of change, continuum of care, and the NIDA treatment principles. Let's get started. First, I want to go over an overview of what we're going to be discussing in this lecture video. First, we will discuss the stages of change, or it's also referred to as the trans-theoretical model by PreContemplation and Di Clemente. Then we will be going over the different levels of continuum of care for treatment of addiction services. And lastly, we will be going over the National Institute of Drug Abuse Principles of Treatment for Addiction Services. Each of these models are grounded in research and are utilized in the treatment of addictive disorders. This lecture video will aid you in the readings that you have been required to do for this module. The stages of change model, also known as the trans-theoretical model, was developed by PreContemplation and Di Clemente in 1983. This model was first identified in a study of smoking cessation. This model goes through the process that individuals go through on their way through change. It originally had 5 different stages: pre-contemplation, contemplation, preparation, action, and maintenance. An unofficial stage of relapse was added to the model later on. Relapse was added due to the recognition that relapse is common and sometimes part of the story for individuals in their addiction treatment. Individuals seeking change may spend a different amount of time in each of these stages, or maybe even skip stages along the way. They can move back and forth between different stages, or they may seek treatment from professionals at different stages. So they could start off at pre-contemplation, or they may meet professionals at the preparation stage. For professionals who work with addiction, this model can be extremely helpful in assessing where each individual is at in terms of their readiness for change. Having a knowledge of motivation from your clients will help professionals determine the best way to engage in treatment. Let's go through each stage and introduce you to the steps and help you understand what the stages of change model can be adapted in each treatment setting. Oftentimes, the pre-contemplation is considered the first stage. However, some people may skip this stage altogether. In this stage, individuals may not see their drinking or alcohol or drug use as a problem yet. And because of this, sometimes this stage is referred to as denial or ignorance is bliss. Therapists rarely see clients in treatment on their own accord if they are in this stage. These clients are often seeking professional help because they are being mandated or coerced by family and friends. In other words, the individual is not actually the consumer of the treatment services at this time. In a professional setting, the individual that is in pre-contemplation stage is often viewed as resistant to change. They do not want to hear about the negative consequences of their behaviors at this point. So professionals should engage them by validating what they're going through, even if they're not ready for change yet. So go ahead and validate that it's their decision when they're ready to change. You can just continue to help them evaluate their current behaviors. As Di Clemente says, we cannot make pre-contemplators change. However, we can motivate them to move towards contemplation, which is our next stage. In contemplation, our clients begin to recognize that the behavior is problematic, but they are not yet committed towards changing this behavior. In this stage, the client is seen as being a little ambivalent, and they won't start the change process for roughly maybe another month. They are viewed as sitting on the fence. They often can move back and forth between pre-contemplation and contemplation as they start to weigh the pros and cons of their decisions. Therapists or other professionals may likely hear the client say, "I know I have a problem, but I do not know what I want to do about it or even if I want to change." It is helpful for professionals to start to help the client weigh the pros and cons of actually changing this behavior. The third stage is preparation. In the preparation stage, individuals may have some experience with change and often are seen as testing the waters. In this stage, they may be deciding whether they want to fully commit to change. Professionals can help individuals in this stage begin to problem solve. You can help them discuss different obstacles that might be in their way, maybe who will support them during this process, or what skills would they need in order to continue on with the next stage. Because professionals want to help the client stay motivated to change, it is best to encourage realistic and small steps that are likely to lead to successful outcomes in this early stage of change. The fourth stage is called the action stage. In this stage, the individual is now practicing their new behaviors. The individual may start demonstrating abstinence of their substance or alcohol use. Typically, this can be anywhere from abstinence for 3 to 6 months. They are typically practicing the skills and behaviors that they learned in their treatment. In this stage, professionals can help individuals identify any new skills that they may need as they continue to develop and go through this stage. For example, what are some of the specific steps they need to take to continue to reinforce this action stage? As mentioned earlier, the maintenance stage was considered the last stage in the Petrosca and DiClemente stages of change model. However, we will talk about the other stages that were added later. In this stage, the individual has maintained their change for about 6 months or more, sometimes up to 5 years. The individual is committed to their new behaviors like abstinence. Typically, the professionals might move towards terminating their treatment services with this client, but giving them resources for anything they may need if relapse or triggers occur. The client is now working towards their own internal rewards for maintaining this change. Because relapse is possible in this disease, professionals should continue to aid clients in understanding that this is a possibility and give them resources for preventing it or for what should happen if it does occur. That way they feel prepared if relapse does occur. Another stage that was added later on was relapse. However, not every person has to go through the relapse stage during their treatment or their addiction journey. In the relapse stage, the person has resumed their old behaviors, which it could be as short as just having one drink or binging for several months. This is often referred to as fall from grace or falling off the wagon stage. Professionals in this stage should help normalize this for the client, support them so that they don't feel the constant guilt and shame, which might continue this drinking or drugging behavior. Help them process the grief that may come with this relapse, and then also help them identify what led to the relapse so that they can prevent another relapse in the future. Then you'll want to go back and check their current motivation for change. It is possible for individuals to relapse and go straight to pre-contemplation, but at times they can relapse and be right back into the preparation stage. So it's different for every individual. Due to criticism within the field, another stage was added, which is considered termination stage. The termination stage is identified as the person who has adjusted to their abstinence and can control themselves even with an addiction trigger present. The stage demonstrates a complete recovery from their substance and no longer has control over them. Many people do not get to this point, and this stage is often still debated in the field because research denotes that addiction is a lifelong disease that somebody may not be fully recovered from due to how the brain reacts to the substance. This slide moves into another important component of the treatment of addictive disorders, which is the level of care that your client might need. The continuum of care of addiction is based on the notion that treatment should start on the lowest level or the least invasive level of care for recovery. The level of treatment should be assessed on the individual's basis and should take into consideration multiple factors that would directly impact the possibility of recovery rather than be based on the individual's preference. As a patient or client goes through the continuum, they may start at the lower levels and go up if greater intensity is required, while some may start at the more intensive levels and may go down through the continuum of care as part of their recovery and maintenance plan. A professional will look at the continuum of care and start with the least invasive treatment programs and then go to the most invasive in this order. The least invasive is a 12-step recovery, so that's like an AA or NA. Then we go up to group therapy. The group therapy is different from a 12-step group in that it is actually facilitated by a therapist or a medical professional. Individual therapy is again with an actual therapist and the client one-on-one. And then family therapy is going to be with the loved one with the addiction, as well as their family members, couple, parents, whatever. Intensive outpatient is typically a few hours a day. Usually they have it at nighttime to work through individuals who work during the day. Then there's day treatment, or sometimes it's referred to as PHP, partial hospitalization, which is from 9 to 5 or usually during the day. So they go to the treatment center during the day and do all of the programming during the day, and then they get to go home at night. Inpatient or residential treatment is 24 hours a day. So this is where they would maybe go to a treatment facility for 30 to 90 days. They would do a program all day and they would actually live at the facility. A most invasive would actually be hospitalization. So this is only done when there's like serious medical concerns or maybe some suicidal ideation, where they would be monitored by medical professionals, typically 24 hours a day. And then while this is not the most invasive, it is kind of a next step, which is aftercare or transitional living. So this is not really treatment, but it supports their recovery and typically is from 3 to 9 months. How a professional makes the decision on the specific level of care needed for their client is an area we're going to focus on this semester, particularly when we complete the module of assessment and diagnosis. So you'll see this again later on. The last thing I wanted to discuss for this lecture video is the Principles of Addiction Treatment by the National Institute of Drug Abuse. So the National Institute of Drug Abuse, or also referred to as NIDA, is an institute whose mission is to lead the nation in bringing the power of science and research to bear on drug abuse and addiction treatment. NIDA supports and conducts research across a broad range of disciplines and aims to quickly disseminate research to significantly improve prevention and treatment of addictive disorders, because we know prevention and treatment of addictive disorders actually reduces the cost that the substance use has on society. The principles of addiction treatment include 13 different principles that have been created based on years and years of rigorous research and offer professionals a research-based guide to treating addictive disorders. You will find this in your required reading for this module. And if you look over it, Principle 8 says that an individual's treatment plan must be assessed continually and modified if necessary based on the client's needs. We can see the importance of Continuum of Care, which highlights the different treatment options that individuals might seek, and should be assessed and based off of what substance abuse or behavior they use, the characteristics of the individual, and the severity of their addictive behavior, among other factors. So you'll want to make sure that you familiarize yourself with these principles and research that supports each principle. Thank you and have a wonderful day.